New reporting indicates that Americans are unfortunately getting slapped with giant coronavirus-related medical bills, including thousands of dollars for simple COVID-19 testing. So Debbie Krebs is one individual who was hit with a nearly $2,000 medical bill after she went in to get tested for coronavirus. She was feeling incredibly sick, and the doctor ran a bunch of different tests and a chest x-ray before giving her a coronavirus test, which luckily she tested negative for. But in the final bill, it appeared that she wasn't tested for coronavirus at all. And based on what Congress has mandated during the pandemic, people are not supposed to be charged for coronavirus testing. Now, she did fight it, and luckily the hospital, after the media got involved, admitted that she did in fact get tested for coronavirus, and they canceled her nearly $2,000 bill. But the New York Times has been keeping track of all of the inconsistencies and all of the problems that Americans have been having when they do in fact go to the hospital looking for help, looking for tests when they think they're sick with coronavirus. So as Sarah Cliff at the New York Times reports, across the country, Americans like Debbie Krebs are receiving surprise bills for care connected with coronavirus. Tests can cost between $199 and $6,408 at the same location. We're not even talking about different parts of the country. A coming wave of treatment bills could be in hundreds of multiples higher, especially for those who receive intensive care or have symptoms that linger for months. Services that patients expect to be covered often aren't, right? So this is part of the problem. Congress was saying that, hey, we want to make sure that Americans aren't afraid to go to the doctor. We want to get a handle on this virus, and in order to do that, people need to feel comfortable going to the doctor, even if they lack health insurance, even if they're concerned about copays. But again, people are understanding that, hey, it's not working out the way that Congress has promised. So for instance, American medical billing is unlike any other developed country, something that we already knew. The government does not regulate healthcare prices, but instead lets insurers and hospitals negotiate fees, thus leaving the government out of it completely in most cases. Those deliberations happen in secret, and patients often do not learn the cost of their care until a bill shows up in the mail. So for instance, one laboratory in Texas had charged $2,315 for individual coronavirus tests. So Woz, I have more details on this, including, some doctors charging for all of the other screenings that they'll do prior to conducting the coronavirus test. But I know that, single payer healthcare is something that you've talked about quite a bit, you feel passionately about, and I think that that would be a great solution to this problem, but I wanted to get some more of your thoughts as well.
Well, it's funny because, I was told by the presidential nominee, Joe Biden, that all we gotta do is improve our already incredible system. People love their private insurance. People love the way things are working, as far as the status quo is concerned, and things would be great. Obviously, I think the key is what you just mentioned about how we handle the prices, the price fixing that goes on between insurers and hospitals. That's the key. The government, the United States government is the single most powerful entity in the world, right? And so the idea that they wouldn't come out and dictate terms to insurance companies and hospitals as far as what the prices are supposed to be, the way pretty much every single other government in the developing world does, it just doesn't make any sense. And we know why the status quo continues, because the insurance companies are in the pockets, or politicians are in their pockets. Their money is in those guys' pockets. These guys are in the insurance companies' pockets, and it's like, no, just get private insurance. The market is gonna take care of you. The market is gonna keep you warm at night, Anna. Don't you know that?
Yeah. No, and by the way, Woz, how are you enjoying all of the options that we have and all of the choices we get to make under this system? There are no choices. There are no options. You lose your healthcare because you lose your job, and it's over.
In a time like this, how are people loving their employer given healthcare right now? Now that they're out of work, like this idea that people just love their employer's healthcare. Yeah, I love it while I'm at that job, while they still think it's cost effective to have it, until some hedgie comes along and starts operating the business. Say, healthcare. I don't think you should do that anymore, right? Like it's absurd the way we handle this. It's one of those things where I find it just so funny that everybody who has quote unquote government healthcare like loves it. Like everybody who has Medicaid loves it. Everybody who has Medicare loves it. In New York, there's this weird thing where you sort of price yourself out of Medicaid at a certain time. And that, I'm telling you, definitely has been an incentive not to work. When it's like, do I do this sort of menial job and lose this healthcare that I have this sick son or this sick spouse or this sick whatever, and have to pay that kind of stuff out of pocket? Like people have to make really hard choices. But again, everybody who has Medicare, and I make this joke, but I'm like, the reason why I think Bernie lost in South Carolina with these older black people is because they already had healthcare. Like they already had Medicare. Like that's not an enticement for them, but like people love it. They truly love government issued healthcare. And when you do get onboarded to a new job and you have to figure out which plan you're gonna pick, like people are sweating these decisions, man. And it's just a silly way to be carrying on in a country that calls itself the greatest country that ever was.
If you happen to be one of the quote unquote lucky ones who's still employed and has decent private insurance, our hospitals are so overwhelmed right now with coronavirus patients that if you go to a hospital that's in network, you might find yourself in a situation where they transfer you to a hospital that's out of network. And guess what? You end up paying the out of network prices if that happens. The system is broken in so many different ways. And a recent poll just found, from April to be fair, but it's one of the more recent surveys that was done. It found that 69% of Americans, including 46% of Republicans, are in favor of a single payer healthcare system in the United States. But you wouldn't hear that if you listen to mainstream media or if you listen to what comes out of the mouths of establishment politicians. We need to fix this system, and the best way to do it is Medicare for all, is a single payer system.
Thanks for watching the Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.